Okay. Hello, my name is Anthony Ayala. Today I'm going to be talking about physical therapy. More specifically, I'm going to be talking about the history of physical therapy. I'm going to be mentioning significant figures who led to the adaptation of physical therapy over the years. Throughout the presentation, you're going to see that physical therapy is actually divided into separate eras. It starts from one era, progresses to another, then it progresses to another. I'm also going to be talking about individuals who paved the way for it to become, for physical therapy to become what it is today. Believe it or not, physical therapy is actually an ancient practice. It dates all the way back to 400 BC. So, three ancient philosophers contribute to, I guess, the creation of physical therapy. Hippocrates, Aristotle, and Galen are those three philosophers who created physical therapy treatments that we still use to this day. Hippocrates, also known as the father of medicine, understood the value of muscle strengthening exercises and was the first physician to recommend therapeutic exercises to his patients due to his understanding of muscle ligament and bone atrophy due to inactivity. He basically knew that if somebody was injured, if somebody was sick, it wasn't good for them just to be lying around all day long. They needed to get up and start moving, and that can progress them to a faster recovery. Also, Aristotle, who was a Greek philosopher, recommended rubbing massage oil and water as a remedy for tiredness. This was the first case of massage therapy. And Galen described kinetic principles of human movement, which led to Romans introducing therapeutic exercises known as gymnastics. Galen had a fine understanding of how the human body moves and different type of exercises that we can use to recover faster within the ancient history. Although physical therapy was technically created in ancient times, the first techniques were created in ancient times. When it actually began as a career and an occupation was during 1914 through 1920. This was known as the formative year, and it was actually originated due to two very historical events in U.S. history: the World War One, along with the poliomyelitis epidemic. These two things were going on at the same time, and there was a lot of tragedy in the United States. So between 1914 and 1919, in a time known as the reformative era after World War One, many soldiers were coming home wounded and disabled. Disability at the time was looked at as irreversible, but due to the large number of U.S. men returning home as disabled veterans, this concept had to change. They couldn't just stay disabled. They needed to get better. These men were young. Physical therapy, which was formerly known as physiotherapy, was created. So at the time, it wasn't physical therapy just yet. People refer to it as physiotherapy. So after World War One, the Army created this separate division of physical called physical reconstruction to apply physiotherapy treatments such as massage and mechanical hydrotherapy to wounded soldiers. The individuals that were performing the new reconstruction therapy were known as reconstruction aides. Reconstruction aides are technically the first physical therapists. They were the first people who performed physical therapy. They weren't called physical therapists just yet. At the time, they were just known as reconstruction aides. The division then separated the division of reconstruction into two separate groups. One group went on to become today's physical therapists, and the other became occupational therapists. Margaret Sanderson was one of the pioneers of physical therapy. She was actually one of the first physical therapists, and she recruited and trained reconstruction aides, and then she would send them off to Europe to help wounded soldiers. Mary McMillan was responsible was the first Mary McMillan was responsible for a training program at Walter Reed for reconstruction aides, and the first major outbreak of poliomyelitis occurred in New York State in 1916, which required more help from physiotherapy and led to the creation of Warm Springs Institute for Rehabilitation. And fun fact, our U.S. President Franklin Delano Roosevelt used this facility rehabilitation for his polio in 1928. Following the formative years was the development years, which ran from 1920 to 1940. So on January 15th, 1921, Mary McMillan created and became the president of the American Women's Physical Therapeutics Association, then later changed the name to the American Physiotherapy Association, for recognizing that men also practice physiotherapy. By 1934, there was already 14 approved physiotherapy schools. In 1946, physical therapy physicians decided to call themselves physiatrists, but the MIA was concerned that the public might consider them physicians because of the suffix "is." The MIA, the AMA, American Medical Association, wanted no confusion, so the name physiotherapist was changed to physical therapist. So this is what we're known as. This is the title that they have till this day. By the 1930s, the American physiology there was faced with two calamities: the growing severity of poliomyelitis and the Great Depression. By May and November in 1934, approximately 2,500 cases of polio were treated at just one hospital. The fact that President Franklin Delano Roosevelt was treated for polio generated large public recognition of the physical therapy. But due to the Great Depression, many hospitals and physical therapy facilities sadly had to close down, which put America in some very hardship times. The fundamental accomplishment years followed the development years, which ran from 1940 all the way to 1970. It was ultimately the World War II that helped restore physical therapy along with the entire United States. The American Physiotherapy Organization continued to grow under its experienced president, Catherine Worthingham. Catherine was actually the first PT to hold a doctoral degree in anatomy and served as the president of the association from 1940 to 1945. In 1921, 6 months after the bombing of Pearl Harbor happened, the first war emergency training course of World War II was initiated at Walter Reed General Hospital. Emma Vogel was actually the physiotherapist that directed the Walter Reed General Hospital program to train physical therapists. In 1944, a separate internal legislative branch was created called the House of Delegates. In 1946, the American Physiotherapy Association changed its name to American Physical Therapists Association. In the 1960s, the U.S. population was changing due to the doubling number of elderly and people becoming more health conscious. Along with the enactment of Medicaid and Medicare, this created great demand for PTs. In 1967, the APTA adopted a policy statement that brought the foundation for the creation of the physical therapist assistant. The title changed from the therapy assistant to physical therapist assistant. Following the fundamental years was the master years, which ran from 1970 to 1996. By 1970, there was already 9 PTA education programs. In the same year, the APTPA, which the American Physical Therapist Assistants Association, offered temporary affiliate memberships to physical therapist assistants. By 1973, eligible therapist assistants were admitted as affiliate members in the National Association. In 1983, physical therapist assistants formed affiliate special interest groups, and by 1989, the House of Delegates has already approved it. The first president was Cheryl Carpenter Davis. During the 1970s and the 1980s, the physical therapy profession continued to expand due to the establishment of Occupational Safety and Health Administration, which is OSHA. And in 1972, Congress added physical therapy services to the Social Security Act. In 1975, the Individuals with Disabilities Education Act was passed, allowing physical therapy to expand into treatment of children with disabilities into public schools. So that just made the occupation grow even more. And in 1981 and 1982, the House of Delegates adopted the policy that physical therapist practice was independent of practitioner was ethical. That separated physical therapists from the physician's control, because before that, the only way for a patient to see a physical therapist was from a physician's referral. And in 1990, the Americans with Disabilities Act assured involvement of physical therapists as consultants to guarantee every individual with disabilities rightful access to all aspects of life. The next era was the adaptation years from 1996 to 2005. In August of 1997, President Clinton signed the Balanced Budget Act to actually eliminate the Medicare deficit. This budget act applied an annual cap of only $1,500 for both physical therapists and speech therapy services. So both of them only had $1,500 in the entire, like, what? Come on now, that's not enough money. So physical therapists and PTA students could not find jobs, and along with experienced physical therapists and physical therapist assistants suffered a significant decrease in income. On November 1999, after bugging of the APTA, the Clinton would finally sign the Refinement Act, which suspended the $1,500 cap cut for 2 years in all rehabilitation settings. Another thing that affected the APTA in these years was the publication of the normative model of physical therapist assistant education. In the year 2000, the association adopted the new evaluative criteria for the accreditation of education for physical therapist assistants. And in 2003, the association bill supporting Congress for the Medicare patient to access physical therapist assistance to treat without a physician's referral. So they fought and fought to get independent access, and in the adaptation years, they finally got it. For the last in the current era, which is known as the Vision and Application of Scientific Pursuit years, which started in 2006 and is now in current day. From 2006 to today, the roles of PTs have become more dependent on the application of the scientific method in clinical practice and implementing new evidence-based approaches for disease prevention and health promotion. PTAs became delegated with the most important responsibility of being the only individuals permitted to assist physical therapists. The House of Delegates and the board of directors of the APTA had been consistently pushing the profession to make physical therapists a doctoring profession, and the APTA is also pushing for direct access of a patient, eliminating the patient's need to visit his or her physician to ask for a physician's referral. This would decrease the cost of health care and not promote overutilization. So the occupation has become very, very scientific based and very focused on prevention, and also we're treating them with evidence-based practices to know that they are giving the patients the best treatment possible. So this would be all for the history. We started from ancient times all the way to current day. Peace out.